This is not just something I use for the Jehovah's Witness patient, for example. I use this for every patient who comes to me.
There are some very simple, very cheap things you can do which would help the majority of people, and this could be done in the smallest of hospitals.
Side effects include not only the transmission of viral diseases that everybody talks about, like HIV or hepatitis B or C, but also new viruses that are prevalent in the donor population.
And we've estimated that approximately in the United States we can expect that 10 to 50,000 patients a year may be dying from transfusion immunomodulation related causes.
Will existing viruses mutate and produce disease? There's no reason to believe that they won't.
I think that the safest transfusion is the transfusion never given.
There is a positive note regarding 2 Belgian hospitals that participated in both studies. After the Sanguis study, they changed their transfusion policy.
They had somehow managed to reduce their blood consumption for major surgery like colectomy for cancer by a factor of 5 at least. The hospital stay was shorter, so we have no evidence of increased morbidity nor mortality.
Our experience with Jehovah's Witness has shown that, first of all, we don't need the hemoglobin levels we assumed were essential previously.
You can anesthetize patients for some procedures, depending upon the patient, as low as 2 or 3 grams if necessary.
It's important to position the patient properly during orthopedic surgery. In my experience, it makes a big difference in spinal surgery.
We can expand the circulating red blood cell mass of the patient before the operation.
So if a patient is cool or cold by 1 or 2 degrees temperature, you are seeing a loss in ability of platelets and coagulation factors to work. So it's essential that we keep the patients normothermic.
Cell salvage is a very important technique because when you use cell salvage, the blood lost by the surgeon is not lost for the patient.
The field now really of blood conservation includes the use of multiple alternatives in a planned way to avoid the need to transfuse a patient with someone else's blood.
In view of the potential for a better patient care and reduced healthcare cost, blood conservation is not an option. It's a must.
There's substantial evidence that reductions in morbidity and mortality and reductions in cost can come with these strategies.
And blood conservation is a very simple method which makes things rather smooth, less expensive, and with a better outlook for the patient.